raised the issue of home care packages and home support services and the significant waiting lists that there are in the Kildare, West Wicklow, South Dublin area. As you will know, it's called CHO7, as the HSE refer to it, Community Health Organisation Area 7. I have been dealing with a number of constituents: stroke victims, cancer sufferers, people suffering from early onset dementia, people with old age who need additional support, a person recovering from the removal of a colon. I've been dealing with these cases all summer, Lascion Corda, and to deal with the waiting lists and the delays, a lot of these people are in this hospital, they're in different hospitals who are, or they're in the community awaiting these additional supports. They're taking up hospital beds that they don't need to be in. There are people on trolleys in this hospital that can be in that hospital bed. These people who are in the beds, who have these issues, have applied for home care packages, and the waiting list is there because the budget seems to have been eroded earlier in the year. It makes no sense, to my mind. Those people want to be at home, as we would want to be at home if we're sick like that, if we can be cared for. And a couple of very basic questions need to be asked. First and foremost, we have got to get a situation where the very significant waiting lists in the Kildare, West Wicklow, Laois area are reduced and dealt with as soon as possible. These are real human stories that are very harrowing to deal with, I have to say. But it also isn't even smart. Even if it's an accounting exercise from somebody in the HSE or Department of Health, it's not good use of resources. We need to support the people that they can be minded at home to free up those hospital beds for people who are on trolleys who need to be in those hospital beds, because those hospital beds are very expensive for the people that are in them, never mind the fact they don't need to be there or don't want to be there. If you compare the Kildare area with of CHO7 with CHO4, which is the Kerry Cork area, similar populations of over 650,000 if you include South Dublin in our area, yet their waiting list in June of this year was less than a quarter of ours. So, did they have the same budget to start with? Were they managed differently? And how has this situation been let happen? We can't have this to happen in the future.
First of all, I want to thank Deputy Fiona Loughlin and Deputy Martin Heydon for raising this very, very important issue. And I know that they have a particular interest in developing the services in the Kildare CHO7 area. The overarching policy of the Government is to support older people to live in dignity and independence in their own homes and communities for as long as possible. Home care is an important part of the supports for enabling older people to remain in their own homes and communities for as long as possible and for facilitating their discharge from acute hospitals. Since being appointed as Minister with responsibility for older people, Minister Jim Daly has made improved access to home support services a key priority. Progress in this area is reflected in the additional funding made available for the winter of 2017 and 18, the increased funding and level of activity for 2018, and in the work being progressed on the development of statutory home care scheme. Home support services were a particular focus in the budget of 2018, with an additional €18.25 million allocated. The HSE has operational responsibility for planning and managing and delivering home and other community-based services for older people. Services are provided on the basis of assessment care need. The HSE 2018 National Service Plan provides for over 17 million home support hours to be delivered to 50,500 people at any time. Intensive home care packages for older people with more complex needs are being provided to approximately 235 people at any time, delivering approximately 360,000 hours in the full year. A further 150,000 hours relating to adverse weather funding early this year will also be provided. This year's home support budget for Community Healthcare Organisation 7 is about 47 million, with an additional adjustment in spring of 1.4 million, in view of the sustained pressures in the community and to address the delayed discharges in hospitals. At the end of June 2018, there were 6,683 people in receipt of home care support services in the CHO7 area. The HSE is working within available resources, has sought to maintain and, where possible, to expand the range and volume of service available to support people to remain in their homes, to prevent early admission to long-term residential care and to support people to return home following acute hospital admission. Despite the significant level of service provision, the demand for home support continues to grow. It is important to note that the allocation of funding for home supports across the system, though significant, is finite, and services must therefore be delivered within the available funding. In that context, it is acknowledged that in some cases access to the service may take longer than we would like. However, Minister Jim Daly is satisfied that the HSE monitors the delivery of home care on an ongoing basis to ensure that activity is maximised relative to the individual client's assessed care needs, with an overall available resources for home support and having regard to demand throughout the year. As part of the estimates process, the Department is actively engaging with the Department of Public Expenditure and Reform in relation to funding for older people services in 2019, including home support services. And of course, Deputy Fiona O'Loughlin, I do listen very carefully to the issues when you raise about the 90-year-old mother waiting and the person in this hospital as well on the discharge issue. Deputy Martin Heydon mentioned the stroke victims and also the hospital beds issues and the home care packages. And of course, these are priority issues, and I will bring your points raised today in the debate to the Minister. Thank you.
Thank the Minister for his response. But, Minister, a couple of questions have to be asked here. Was the initial budget for the home care package for the Greater Kildare area sufficient to start with? And why is there such a disparity between our area and other areas of similar population where our waiting lists are greater? I accept there was additional funding given in the spring of this year as a result of Storm Emma. You know, Storm Emma affected many parts of the country, yet Kildare seems to have been disproportionately affected. And that additional money didn't provide any extra home care packages for the Naas Hospital area. It did. All went into Tala and James's. I suspect not much money went into community either, and that is a challenge for us here. We have to learn from this. I want to acknowledge the role that management play in Naas General Hospital. I suspect they were nearly punished in the spring for not having many delayed discharges and managing as well as they possibly could. I also want to acknowledge I deal with some great people who are managers and work in the HSE and the Department of Health. And on an individual basis, that's great. But the system has to be looked at here. We have to learn from this situation. First of all, we have to ensure money goes in, that we clear the backlog of a very significant amount of Kildare people who do not have access to home care packages at the minute who need it. We then need to understand why this happened and ensure it doesn't happen again. And I will keep asking these questions until I get answers to that, Minister, because this is too serious and there's too many people affected by it.
Arrangements for home care have developed over the years with a significant local focus, and there is considerable variation in access services in different parts of the country. It is also accepted that there is considerable demand for home support services over and above the existing service levels. So your main points, you have hit the nail on the head. The programme for partnership government, though, includes commitment to increase the funding for home support services, and as I mentioned earlier, in the Department is actually actively engaging with the Department of Public Expenditure Reform in relation to funding of older people services in 2019, including home support services. So that's the first thing. The Department is actively engaging on this particular issue, so we're listening to your concerns. I'd also like to mention that my department is currently engaged in a detailed process to determine what type of home care support scheme is best for Ireland. I am happy to say that we reached an important milestone in the development of a new home support scheme in June, when we published the report of the findings of the public consultation on home care. The consultation process took place last year, and approximately 2,600 submissions were received. And the report includes a number of interesting points made by respondents in relation to innovative funding models and is available on the Department's website. The findings will now be used to help to inform the design of the new home care scheme. In the meantime, the Department and the HSE are continuing to improve the existing services, including in 2018 the introduction of a single funding stream for home support services. This new approach is providing significant benefits, including the making of service users easy to understand, streamlining the application and decision-making processes, and facilitating service users to move to change levels of service as their needs change, without the need for additional application process. But we also have the other reality where there has been a 12% growth in the overall population. We have a 59% growth in the 65+ population, and we have a 95% growth in the over 85s. So the HSE as well, what we're doing is a classic example of what we're trying to do is the HSE has undertook a new tender for home care, which is expected to run from the 1st of September 2018 until December 2020. A list of 48 approved providers is available for the provision of home care support services across the 9 CHO years.
We'll move on to the next, and the name is Deputy O'Snoddy and Deputy Breed Smith. Deputy O'Snoddy,
Minister, I don't know how aware you are of the situation, the financial situation of MDY. Some reports are that it's in receivership, or if not, it is definitely in financial trouble, given that all of the subcontractors have left all of the sites, taken all of their equipment and left.